Hello. Today, we're going to talk about the mental health of Purdue students. My name is T. You're also going to be talking to Kinzie, Mark, and Simon. Mark is going to talk about how there are already solutions being held at Purdue. Kinzie's going to talk about possible solutions, and Simon is going to talk about the root causes. I'm going to be talking about how Lafayette is already being affected by this problem. I also want to define what mental health is. It's a person's mental state regarding the psychological and emotional well-being. We're going to be specifying young adults, which would be college students, and how financial stability, stress, anxiety, and depression can affect their mental health. You're going to see that maybe students who are withdrawn from classes act different between themselves and with friends in their jobs are affected by this mental health. I'm going to pass it along to Kinzie to talk about our thesis statement, and then we're going to start our presentation. I hope you guys enjoy. Thank you.
Hi, my name is Kinzie, and I will be now talking about our thesis statement. Mental health awareness is a growing topic in today's society, and it is a topic that needs to be addressed. The state of Indiana is in the midst of an uncertain time, and it is important that mental health-related topics are advocated for in areas such as school and the workplace, but especially at Purdue University. I will now pass it on to Simon, who will be talking about the root causes of the issue.
Mental health issues have been a growing problem among colleges in recent years, and there are a lot more causes to it than you may think. According to Greg Henriquez, PhD, as reported, college students are showing greater levels of stress, anxiety, depression, eating disorders, and poor sleep patterns than any time in our nation's history. Out of all of those, the main ones to focus on are stress, anxiety, and depression. First off is stress. Stress is something that we may all feel because it's fairly common among college students. And as you can see here, these are some of the causes of stress. So the big one is school, having assignments to turn in, all of these due dates to keep track of, exams, having to go to class, all of these things. These are causing people to be stressed, which in times of COVID is probably much higher than normal just because of how COVID has been affecting everyone's lives. Also, according to Will Evans, a guest speaker who presented in my health and kinesiology class, in a Purdue-specific survey, 90% of students reported experiencing moderate to extreme stress. That means that 90% of the population at Purdue, which is about 37,415 people, are experiencing moderate or severe stress in their lives. Besides stress, there are anxiety and depression. A survey by the Association for University and College Counseling Center directors says that anxiety and depression are the biggest concerns among college students. The survey says that 41.6% of students suffer from anxiety problems and 36.4% of students suffer from depression. These rates are incredibly high, which means that there are probably a lot more people that suffer from these things than you may think, and it could possibly be you because of how high the numbers are in these times. Now I'd like to hand it over to T to talk about how mental health issues affect the greater Lafayette area.
Hi, I'm T, and I'm going to be talking to you guys about how the Purdue mental health is affecting the greater Lafayette community. I want to start off by showing you guys this diagram that talks about how students at another college, the College of Charlotte State, took a survey on their students' mental health. About 25% of college students have been diagnosed for a mental health condition. 1 in 4 are found to be diagnosable. 73% have reported that they've had emotional crisis on campus, and 34.2% have reported that their college does not know that they struggle with a mental health condition. Going back to not sharing that, I also want to talk to you guys about how Greater Lafayette is not actually affected negatively by the mental health of Purdue students because Purdue is doing so much to help their students. In addition to that, Lafayette is also helping their people to stay away from the negative conditions. So in an article by UDMH, How Mental Health Affects the City, they said that people with mental health are more often likely to experience discrimination. Now, when you think about that, do you think Purdue students face discrimination when they're trying to talk about their mental health? I don't think so, because Purdue offers many ways to help Purdue or students. But we do have to be willing to go to talk to them rather than keeping it to ourselves, so we're not a part of the 73% that has mental health crisis on campus without their college knowing. An article by tpchd.org called Unattended Mental Health Impact of 2016, unaddressed problems can have a negative influence on homelessness, poverty, employment, safety, and the local economy. Keep that in mind, because once again, is there a negative impact, or is it because we have community-based services in Lafayette and in Purdue that helps us stay away from that negative impact? In Lafayette, you can find a bunch of offices in which you can go to talk about your mental health. You can go to offices to talk about doctors, and if you're a Purdue student, you can talk to the people that Mark is about to tell you about in his part of the presentation. Thank you.
As many of you are aware, the past 8 to 9 months have been very difficult dealing with the COVID-19 pandemic. The pandemic not only has caused layoffs, but has caused stress and anxiety among adults, teenagers, and many families. The mental health of many people in the greater Lafayette area has been affected by the pandemic, along with the pressures of school for many high schoolers and college students at Purdue University. According to the Journal and Courier, as of last month, there have been 94 positive COVID-19 tests and 1,645 quarantines among the greater Lafayette schools. According to protectpurdue.edu, for Purdue University, there's approximately been 2,539 positive COVID-19 tests this semester. To help with this problem, Purdue implemented something known as the Protect Purdue Pledge, which requires students and faculty to wear masks at all times, properly social distance, and to properly sanitize. During all of this, the mental health of many people in the greater Lafayette area has been affected. So how is this issue being addressed? According to Purdue.edu, to help students and faculty, Purdue provides many different options for students to receive mental health help, such as at the Purdue University Student Health Center, counseling and psychological services, and Purdue Student Help and Crisis Line. These resources allow students and faculty to have counseling resources and are provided a support group to help deal with their stress, anxiety, and mental health. In the greater Lafayette area, there are many locations for residents to seek help, such as at the Mental Health of America, Modern Mental Health Incorporated, Arlington Counseling, along with many other options. Residents can receive counseling and support to help with their mental health along with their many problems.
I will now be talking about 2 ways the problem can be better addressed in the state of Indiana. Author and journalist Lada Nervanka Hayes states that 1 in 5 adults face mental health-related issues every year. She states that many of these issues go unresolved due to the stigma around seeking mental health treatment. One way this can be better addressed is by providing more education about mental health awareness and talking it out with peers to help break down the stigma. The stigma surrounding mental health makes it very difficult for people to seek treatment when they are feeling stressed or dealing with other mental health issues. People tend to look at mental health as not being worthy of talked about, or feeling that it is not okay to not be okay. This is a dangerous mindset for society to have, because mental health is just as important, sometimes more important, than physical. The well-being of people affects how they are able to perform in everyday life situations, just as the effect it has on their eating, drinking, and social habits. Poor mental health that is not treated leads to severe physical health complications, which unfortunately can result in suicide. In an activist community such as the student body of Purdue University, there needs to be an effective effort to help destigmatize mental health and help encourage students to seek help when they are struggling. Another way to increase the mental health awareness in the state of Indiana is by taking the advice of WHO, Western Pacific Regional Office, and how to promote mental health in society. WHO started a campaign in 2017 called Let's Talk, which addressed mental health issues such as depression, promoted workplace mental health, developed suicide prevention strategies, and addressed ways to reduce the availability and access to alcohol. By talking about how mental health issues affect a large number of the population in the state of Indiana, people will become more aware of the issue and not feel as afraid to share their own stories. Mental health advocacy and education needs to be incorporated into schools, the workplace, laws and policies, and just about every other aspect of our lives. It would be beneficial for Purdue University to create more outreach programs to help advocate for students to seek mental health help and counseling. It would also be beneficial for them to include classes and general education requirements for all students to learn about how their well-being affects their schoolwork, social life, and overall health. Mental health is an extremely important topic to talk about, and the state of Indiana, along with Purdue, should take the advice of WHO and incorporate these lessons and campaigns into schools, the workplace, and laws and policies. I am now going to share with you a graphic presented by Children's Health about 5 ways to end the mental health stigma. First, you can educate yourself and your children about mental health. Share real-life examples of people with mental health disorders. Explain mental health has a range of symptoms. Listen to and support others with mental health concerns, and share stories of overcoming mental health and disorders. I will now pass it on to Simon and Mark, who will conclude our presentation.
As we've talked about earlier, mental health is a person's psychological and emotional state and affects students differently. It affects how they might act at work, with friends, and with family. For example, someone at work may be super hardworking, pretty quiet, just works for themselves, gets everything done on time, never misses a deadline, anything like that. And then they could go home and be with their family and it could completely change. They could be super quiet and reserved, never doing anything, not listening to what they're told, something like that. And the same goes with when they're with friends. When they're with friends, they could be super outgoing, loud, funny, always down for anything. But then they go back home and it is the opposite. They don't want to do anything, don't really talk to anyone in their family. But it all just depends on who it affects. Mental health awareness is a growing topic in today's society and is a topic that needs to be addressed. The state of Indiana is in the midst of an uncertain time, and it is important that mental health-related topics are advocated for in areas such as schools and the workplace, but especially at Purdue University.
In conclusion, during these difficult times, the mental health of many people in the greater Lafayette area has been affected. COVID-19 prevents those in nursing homes and hospitals from receiving guests, and many people are not allowed to visit others or enjoy activities that they once were able to do. Mental health is a very important aspect of life, and it is important to constantly check up with others, especially your loved ones. Make sure you frequently check in with others to make sure they know that they are doing okay and that they know that you care for them. Not only has the pandemic created a great deal of stress, but students are also facing many challenges, which have a toll on their mental health. According to a Purdue study, 90% of students reported experiencing extreme to moderate stress, and 1 in 5 adults face mental health issues each year. Mental health is a very serious topic that needs attention from all of us to help those in need and help put an end to many people's problems.